kidney transplants to be delayed for unvaccinated patients until COVID crisis passes.
Here's a summary of the article.
Consultants involved with the National Kidney Transplant Service have been advised to suspend unvaccinated patients on the waiting list until the COVID crisis passes, according to a new letter. In a letter to consultants dated August 3, the surgical director of the National Kidney Transplant Service, Ms. Dilly Little, and Dr. Colm McGee, requested they furnish them with a list of patients who are on the transplant waiting list who are currently not vaccinated. We would strongly urge patients that are potential transplant recipients be immediately vaccinated for COVID, the letter states. If your patient cannot be vaccinated, for whatever reason, we would recommend that they be suspended from the waiting list with immediate effect until the COVID crisis has passed and there is no risk of transmission of COVID for the individual patient or to members of staff or other patients who are immunosuppressed on the transplant unit. On Friday, Beaumont Hospital said despite significant challenges, the national transplant programs continue to operate through this phase of the COVID pandemic. In the setting of ongoing community transmission of COVID-19, patients who are unvaccinated are at very high risk. In addition to the personal risk, a transplant recipient with COVID-19 may unintentionally introduce infection to a transplant service, creating a risk to other transplant recipients. The hospital said that in order to protect all immunosuppressed transplant patients from the virus, it is expected that all individuals engage fully with the available measures to protect themselves, including vaccination against COVID-19, strict adherence to non-pharmacological interventions and cocooning at home after transplant, except for essential hospital visits.
This post received a score of 4,700, with an upvote ratio of 95%. Here are the top comments in response to this article.
It will be years until the COVID crisis passes.
House money is on endemic.
Thanks to the abundance of fucking morons in the population.
It is worldwide and there is worldwide travel. Even today. Though the Canadian land border is closed, Canadians can fly into the USA. Look at air traffic coming into USA from all parts of the world. Until the world is vaccinated, it will be endemic.
TBH, worst time to get a respiratory ailment is when you're getting surgery.
And receiving immunosuppressive drugs to facilitate an organ transplant.
What I find funny about this the most is that pre-transplant it's recommended you get any and all vaccinations that you can whilst you're not on immunosuppressive medications, as once you're on said medication you can no longer have any live vaccinations ever again. You can, and should, however has as many inactive vaccines as you need to have, such as the yearly flu shot or the COVID-19 vaccine. I have had both my Pfizer COVID vaccines and suffered little to no side effects from them. Source: am 3 years post-op kidney recipient, second time round.
You can get inactive vaccines after a transplant, but that doesn't mean they'll be as effective as they would have been if you'd gotten them first. At this point, people who aren't getting the COVID shot before their kidney transplant are people who don't intend to ever get it. Which is a terrible fucking idea if you want an organ transplant. Yeah, pretty sure COVID has a 100% or close to it kill rate on unvaccinated who are on immunosuppressants. Would be a waste of an organ knowing that person will absolutely get infected on the table or shortly thereafter.
I'm curious as to how a pre-transplant and pre-immunosuppressants immune system carries this over and if a third shot would be needed upon receipt of the transplant.
Getting a vaccine while immune system is working normally is like a healthy smart person learning to become a neurosurgeon. Becoming immunosuppressed is like that well-trained neurosurgeon trying to do surgery while drunk. Not the best idea, but still better than some rando off the street. Getting a vaccine while already immunosuppressed is like trying to put a drunk through medical school and neurosurgery residency. Most likely, everyone will need periodic booster shots.
That's a brilliant analogy and I usually hate analogies.
You can't get a liver if you are an alcoholic. Same principle.
I received a kidney transplant at the beginning of April in Canada just because there was a window to get it done. Although I kind of wish I received my vaccines before the surgery because there's a really big chance the double Pfizer dose I got 1 month post-op did nothing.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.